How often does lung cancer recur as a new primary? Lung cancer recurrence can be a complex topic, especially when we talk about it coming back as a new primary cancer. So, how often does this happen? Lung cancer can recur in two main ways. It can come back as the same tumor or appear as a completely new primary lung cancer. This new cancer develops independently from the original one. The frequency of this occurrence varies based on several factors, including the stage of the initial cancer and how long it has been since treatment. Research indicates that in patients with early-stage non-small cell lung cancer, about 6% may develop a second primary lung cancer over time. This percentage remains fairly consistent over the years following the initial diagnosis. This means that even many years after the first cancer, new primary lung cancers can still emerge. On the other hand, patients with more advanced stages of lung cancer, like stage 3 and non-small cell lung cancer, show a lower rate of new primary cancers. Some studies have reported only a handful of cases in this group, suggesting that those with early-stage cancer are more likely to develop a second primary lung cancer since they tend to survive longer and are monitored more closely. To define what a second primary lung cancer is, it must meet certain criteria. It should occur in a different lobe or lung than the original tumor and have different histological or molecular characteristics. In some cases, it can even arise in the same lobe if it shows distinct pathological features and is outside the treatment area of the first cancer. Because these second primary lung cancers can develop many years after the initial diagnosis, ongoing surveillance is crucial. Regular checkups, including yearly computed tomography scans, are recommended to catch these new tumors early. This is particularly important for survivors of early-stage lung cancer, who have a longer life expectancy and, therefore, a higher cumulative risk of developing a new primary lung cancer. In summary, about 6% of early-stage lung cancer patients may experience a new primary cancer, and this risk continues over time. Long-term monitoring is essential for early detection and effective management of these new tumors, which differ from the original cancer in both biology and clinical behavior. Always consult with healthcare professionals for personalized advice and follow-up care regarding lung health.